Hey everyone, this is Dr. Ashya here. I'm homeopathic consultant and counseling psychologist. Today's video is about debunking myths of homeopathy. So there are many myths, controversies surrounding the homeopathy and its method of preparation, its usage, its applicability. So in this video we are going to discuss all about it. So let's get started. So the first myth is homeopathy is slow acting medicine. Many people have the belief that homeopathic medicine can only treat conditions which are of longer duration because the medicine, the mode of action is very slow. But that is not the case. Homeopathic medicine can provide relief and show actions in span of minutes provided the medicine selected is appropriate to the case and the dosage and the potency given by the doctor is the right one. So we can treat acute conditions like viral fevers, vomiting, dehydration, diarrheas, and to a certain extent we can also treat renal stone, which is like almost like an emergency condition where the patient is in distress when the stone is in the verge of being excreted out. That's also a kind of emergency condition where the patient is in much distress. In that condition too, homeopathy can be helpful. It can be useful in bronchospasm, the wheeze, and also sometimes in angina. I mean the angina where we have chest pain, the patient is in distress. People usually take sublingual nitroglyceride for immediate relief. In that conditions too, homeopathy can be beneficial provided the medicine selected is appropriate one. Okay, we go to the second myth, which is treating chronic diseases only. People have a belief that homeopathy can only treat chronic diseases of longer duration. Chronic diseases are the diseases which are of longer duration. Let's say osteoarthritis, migraine, asthma, and all these things which are of longer duration, which don't happen in a short period of time. Obviously, acute attacks are there in any disease or any pain, but these diseases take a long run. So, but that is not the case. As I have explained the mode of action, homeopathy can be effectively used in treatment of bacterial and viral infections, bacterial viral fevers like typhoid, malaria, chickenpox. It can be useful in cold, flu, sinusitis, conjunctivitis. All these are of acute duration, that is of shorter duration. And in fact, historically, if we see, homeopathy was initially used in the treatment of typhus fever and cholera when it was invented in the 17th and 18th century. The third myth is that homeopathic medicines are unscientific. Now, this is a long-going myth which has been since ages. People have been criticizing homeopathy, saying that it is not scientific, it doesn't bear medicinal properties in the high dilutions which we use, because when we dilute the medicine and we put it under the microscope, people say that there is no tangible medicine in the resultant medicine dilution. But that is not the case. In the recent researches done and the results being published in International Journal of Homeopathic Sciences have shown that homeopathic ultra high dilutions also possess the medicinal properties in it due to the presence of nanoparticles. Let's say if we take a dilution of medicine prepared from plant Hypericum, so the Hypericum plant, even in the lowest dilutions till the highest dilutions, all the dilution have possessed nanoparticles in it. For a brief introduction, let me tell you, nanoparticles are nothing but the molecules or the particles which are very relatively small size, let's say to the power of 10 to the power of minus 9. So the particles are that small, but still the medicinal particles are now visualized. So homeopathy is now free of the unscientific paradigm. Let's go to the next one, which is next myth is placebo effect. Many people say that homeopathic medicines don't have any medicinal value, it's only a placebo effect. Placebo effect is something which is like a null, a void. People just give it just to satisfy the patient, just to please the patient, and there's nothing out of use. But that is not the case. Because we prescribe and we dispense our medicines in sugar pill doesn't mean that it has a placebo effect. Let's consider an example. We use neem. Neem is a medicinal plant, medicinal tree which has antibiotic properties in it because of the active principle azadirachtin and nimbidol. So our homeopathic medicine Azadiracha indica is a medicine prepared from the bark of neem tree. So this medicine possesses antimicrobial properties because of the active principle azadirachtin in it. So this azadirachtin active principle has anti-inflammatory effects which can be useful in treating viral infections, skin diseases and all. So this clearly indicates that medicines prepared from plants, medicine prepared from minerals all have the active basic working principle in it. So medicines given are not null or void, but they do have medicinal properties which when given to patient can be helpful in treating their illnesses. So the next is the fifth myth is self-medication. So people what usually do is they Google it the symptoms or they search in YouTube. They find what symptoms and what medicines are appropriate for them and they start using it. Although it's a safe medicine which doesn't have side effects, but it is better to consult a physician nearby you or your trusted homeopathic physician before starting on any medicine, because homeopathic medicines are multipotent, which means the medicines we use have multiple uses and multiple potencies to select from. If we select a medicine according to the symptoms as depicted by the YouTube doctor or the Google anything, what happens is in most of the cases the symptoms are being reduced, but in some cases there can be two phenomena. One is some symptoms can be there which can be of lower intensity, while some symptoms tend to go off and then recur back due to lifestyle changes. So before taking a medicine it's better to consult a physician. With this we have come to the end of a video. Hope this clarifies all the myths about homeopathy. Thank you for being with me. Stay tuned.